Now, speaking of cuts, I do want to transition to the GOP budget bill, which has proposed cuts to Medicaid, and then there are tax cuts. The administration is saying it wants to weed out waste, fraud, and abuse. Senator, what is your position on this budget bill, and what do people need to understand about which areas of American life could be most affected if it passes?
Right. So a little over a week ago, in the middle of the night, House Republicans passed their budget reconciliation bill. What Donald Trump has been calling the big beautiful bill, what we're calling the big beautiful betrayal, because that's really what it is. In combination, the health care provisions would terminate the health insurance of about 14 million Americans, including just under 230,000 Wisconsinites. Some of those people would lose their Medicaid coverage, and some of those individuals would lose their health care through the Affordable Care Act because the Republicans intend to allow a tax credit to expire that helps low-income people be able to afford the premium for their private insurance in the Affordable Care Act marketplace. 14 million Americans, their health care being terminated so that Republicans can finance a portion of their tax breaks for big corporations and the wealthy, stealing from those who are most vulnerable in our society to pay for these tax breaks. It goes beyond healthcare. There's cuts in this measure to nutrition assistance programs, things that low-income individuals and families rely on to get the nutrition that they need if they are not able to pay for the grocery bill. And we all know that those prices are going up all the time, and may even be worse if Trump passes his tariff or puts his tariffs fully in place. So this bill is uh, really, in my mind, sort of like Robin Hood in reverse, taking from the most vulnerable in order to pay for a huge tax break for corporations and the wealthy. And in the Senate, we are fighting to stop this from moving forward. My Republican colleagues have been hearing from their constituents uh, about the cruel impact that cuts to Medicaid would have on seniors who are in nursing homes, on critical access hospitals that could close, on people with disabilities, both children and adults who rely on Medicaid for both healthcare and services to allow them to live as independent a life as possible. And remember, a third of all children are their healthcare comes through Medicaid. So we're going to do everything we can to stop these devastating cuts.
Doing everything you can. What does that look like? And do you think it's possible, a similar question that I asked with the NIH, is it possible to get enough support from the Republican side to create a better path forward that perhaps doesn't affect as many millions of people as you just outlined?
Right. So the tactic we're using is as old as can be, and that is engaging the constituencies, engaging the people of each of our states to let their elected officials know, whether that's House members or senators or even state legislators, because part of this measure is passing the burden to the states. And so there's a lot of folks there who are going to be left with huge challenges if they don't help us fight back. But what I can tell you, I've held 10 roundtables all across Wisconsin on the issue of Medicaid. They've gotten a lot of publicity, and people are understanding that cuts to Medicaid are things that will hurt their neighbor who has a child with a significant disability and needs that health care and those services. They understand if they're a caregiver for an elderly, frail parent who needs skilled nursing care, that this is about them and their families. and they are talking to my Republican counterparts. Now, the other thing I would say that we're finding, they always say the expression, politics makes strange bedfellows. And what I will tell you is that there are some, including my senior senator, who has looked at the bill that the House passed and said, this is going to worsen the deficit, it's going to worsen the debt, and I'm not going to vote for it unless the cuts to government are even steeper. The cuts to programs like Medicaid and food stamps are even more severe than the ones already there. And then I have other Republican colleagues who are saying, wait a second, these cuts are way too steep right now. This is going to cause real harm to my constituents. So right now there are uh, different groups of Republican senators who are expressing their misgivings about what the House passed. My prediction is that the Senate Republicans will write a new bill and will try to figure out their path forward. But at this point in time, I don't think if the vote were held today that the bill that the House Republicans presented us with would pass.
If the vote were held today, you don't think the bill that the House Republicans wrote would pass. That is an interesting prediction. We will have to have you back if and when that comes to fruition. But we have about 30 seconds left. Is there anything else you would want the Forbes audience to understand about this budget bill and what happens next?
Well, I would go to the point that I was just making about how much people's voices and their stories matter. So reach out. Don't be shy about calling your elected representatives, registering your opinions about how this measure would impact you, your neighbors, your communities, your state.
Senator